Well, our lead story tonight, we are tracking closely every aspect of India's third wave. India is now at over 90,000 new COVID cases in the last 24 hours. That's up 56.5% from just 24 hours ago. So clearly, as the doctors have told us, it's driven by the Omicron variant, because this kind of rapid transmission is something we didn't see in the second wave. The deaths are 325. That's down mainly because yesterday's deaths had a backlog of Kerala reporting the deaths late. Tests are 1,41,000. The vaccinations are at 90 lakhs. So that's again a good number. Now over 90 lakhs is vaccinations. That's really our only weapon along with masks to fight this disease. But look at how the positivity rate has jumped. That's 6.43% now. And let's just look at how rapid that rise actually is. We've gone from 7,000 cases just over 3 weeks ago to 90,000 cases in the last 24 hours. In fact, with the latest numbers that come out today, is likely to be over 100,000. So there you can see the rapid rise and the percentage increase from 1 week ago, where it's a 13,000 percentage increase, then 2 weeks ago, and 4 weeks ago, the rapid increase of over 9,419% to over 90,000 cases today. So here's what the government says. These are the 15 districts that are contributing the highest number of cases on a weekly basis. This is an analysis done between the last 1 month, from December the 4th to January the 4th. So topping the list is Mumbai, followed by Kolkata, then Thane, also in Maharashtra, Mumbai suburban, Bengaluru urban. So you can see again the positivity rate here really rising. Then Pune, Chennai, 24 Parganas north, again in West Bengal, Gurugram in Haryana, Ahmedabad, and Thiruvananthapuram, Howrah, and Ernakulam in Kerala, and Ranchi in Jharkhand. So these are the top districts where the rise has been the most on a weekly basis of cases. So the latest numbers coming out right now. So Mumbai's cases, now remember yesterday they touched the highest ever tally of over 15,000 cases in 24 hours. Today it's over 20,181 cases. So again, it's a new record, and 4 deaths recorded in Mumbai in the last 24 hours. So that's good news that it's only 4 deaths. But remember, there's usually a lag between cases and deaths of 2 weeks. However, the number of patients also was not that high, though the ICUs are filling up. Over 1,170 patients are in Mumbai hospitals today, as over 20,000 cases. Well, Delhi is not that far behind. Delhi is at just over 15,000 cases today, 15,097, up 41.5% from yesterday, where we just over 10,000. We can see again the rapid rise there in 29th December, just about a week ago. It's up now 2,943% from 496 cases just last week to now over 15,000. Patients admitted are over 1,000 as well, admitted to hospitals. However, of them a majority don't need oxygen or ventilator support. There are 211 patients admitted who need oxygen support, and 24 patients are on ventilator in critical condition. So the main point, remember, Omicron is not necessarily mild at all. People can die of it, so be careful. And the biggest concern now is the fact that being hit hard in this third wave, the front line really who's being hit are doctors, nurses and healthcare workers. Booster shots for them still haven't started. So today the health minister, to show moral support, actually visited with COVID positive doctors at the All India Institute of Medical Sciences. We can see there the health minister in a PPE suit, a shield and N95 mask, going in to meet COVID positive doctors. Some have asked, should he be meeting doctors who can potentially infect him, but presumably he's taking the same risks that doctors are taking every day. So the health minister meeting there with COVID positive doctors at the All India Institute of Medical Sciences. This coming as across India, but especially in Mumbai, which is now India's COVID capital, doctors and nurses are falling sick, leading to a severe shortage of staff in hospitals.
Dr. Praveen Dhage works at Sion Hospital with COVID patients. He himself is now COVID positive. From his isolation facility, he speaks to us, warning of a looming crisis.
Those who are positive and admitted in hospital, they are repeating their swab after 5 to 7 days, and after the once the swab comes negative, the resident doctor joining back their duties and providing the service to the patient and fighting this COVID situation.
2 big government hospitals, Sion and KEM Hospital, have seen a big surge. 157 medical workers in KEM testing positive in the past 4 days, while 80 were infected in Sion in the last 7 days. While at the government-run St. George's Hospital, over 40 doctors have been infected, including Dr. Bhushan Wankhede, the Chief Resident Medical Officer, who tested negative just a few days back.
5 days back we got some symptoms, so tested, so got positive. And means frequently we are in contact with the patients. You all know that suddenly the surge of patients has been increasing and mostly gets the symptoms, and also they are getting positive, and the admission rate is also increasing. So in getting in contact with the patients, all are getting positive.
A member of Maharashtra's COVID task force says it could get worse.
This is probably going to get even a little bit worse than what the numbers are appearing to be right now. How long it's going to continue? The peak should be coming by the end of January, by all mathematical calculations and by the trends that have happened in other countries.
Private hospitals are diverting doctors from other wings into COVID care.
Even though some of our colleagues have been tested positive, we are able to manage and run the scenario. The other thing which is probably working, because the elective non-COVID cases are comparatively down, so the resources are getting diverted for COVID facility.
Hospital authorities warn they're being able to manage the situation currently because those resident doctors who tested positive just days ago are back at work after testing negative. But if hospitalizations and the recovery period continues to increase and more doctors are down with COVID, then a crisis is around the corner. In Mumbai with Ashok Saurabh Gupta, NDTV.
So hospitals around the country hoping for the best. Remember, booster shots start on the 10th of January. That's next week. But why didn't we do booster shots when it was clear this wave was coming globally and India would be hit next? Meanwhile, the other big headline, and this is the day after the security breach with the Prime Minister and his convoy in Punjab, matters have escalated. The President met with the Prime Minister today. The President expressed serious concern over the security lapse. Government sources have also contradicted the Punjab police and their claims. Also today, Chief Minister Channey, to make a political point, stopped to meet farmer protesters. He also briefed Congress President Sonia Gandhi with what the latest was on the security lapses. An inquiry committee has been set up by Punjab. But the BJP chief ministers and BJP leaders today held pujas in temples across the country of the Mahamrityunjay Jap to pray for the Prime Minister's long and healthy life.
The BJP holding yagnas for Prime Minister Modi's health and long life in multiple cities. The chief ministers of Madhya Pradesh and Tripura leading the prayers in their states. A day after the Prime Minister's convoy was stuck on a highway in Punjab for 20 minutes. Even the President stepped in. Prime Minister Modi met with the President and gave him a first-hand account of the security breach. Prime Minister Modi was on his way to Firozpur in Punjab for an election rally when his route was blocked by protesting farmers yesterday. But the big question still remains unanswered. Just who is responsible for the security lapse? The centre has now made a point-by-point rebuttal of the Channey government's claims. On the claim that Punjab government and police were not informed of road journey, Government of India sources say that the SPG discussed contingency plan for road journey from Bhatinda to Firozpur with Punjab administration and the police on the 1st and the 2nd of January, and that the contingency rehearsal for road journey was done on the 4th of January. On the claim that there was a sudden change in Prime Minister's plans and that the Punjab police were unaware, the Government of India sources say that the SPG discussed change with the DGP of Punjab and that the road trip was planned after Punjab DGP's go-ahead. The central government sources also say that the SSP Bhatinda piloted the motorcade from Bhatinda to Firozpur district border. On the state government's claim that Punjab police wasn't aware of security threats to the Prime Minister, the Government of India sources say that the internal documents from Punjab police show multiple communications. On the claim that it is SPG's duty alone to secure the Prime Minister, the central government sources say that the SPG Blue Book Chapter 1 Rule 1 says that the overall responsibility is with the state, proximate security is the SPG's job, and that the state police's job is to make all protective arrangements and implementation is DGP's job. And finally, on the claim that the Punjab government and police did proper job in terms of security, The Government of India sources say that the police control room failed to inform motorcade pilot about the so-called protesters. Sources also say that had the information been given in time, Prime Minister getting stuck on the flyover could have been averted. They go on to say that because of this, Prime Minister's car was very close to the so-called protesters. A video has now also emerged of a farmer leader who clearly did not believe the Prime Minister's convoy would pass that way, despite police announcements.
ਆਪਣੇ ਕੋਲੇ ਪ੍ਰਸ਼ਾਸਨ ਵਾਲੇ ਵੀਰ ਆਏ ਸੀਗੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਵੀ ਯਾਰ ਸਾਡੀ ਨੌਕਰੀ ਖਤਰੇ 'ਚ ਮੋਦੀ ਨੇ ਲੰਘਣਾ ਆਪਾਂ ਇਹਨੂੰ ਮੈਨੂੰ ਵੀ ਸੱਚੀ ਲੱਗਾ ਵੀ ਯਾਰ ਜੇ ਮੋਦੀ ਨੇ ਲੰਘਣਾ ਵਾ ਤੇ ਇਹਦਾ ਵੀਰ ਹੀ ਆਪਣੇ ਵੀ ਕਰ ਦਈਏ ਪਰ ਬਾਅਦ 'ਚ ਪਤਾ ਲੱਗਿਆ ਵੀ ਮੋਦੀ ਨੇ ਲੰਘਣਾ ਹੀ ਨਹੀਂ ਇੱਥੋਂ ਦੀ ਉਹਦੇ ਗਾਂ ਸੈਣੀ ਵਾਲੇ ਫਿਰਦਾ ਭਰਾ ਵੀਰ ਜੀ ਬੜੇ ਸਨਮਾਨਯੋਗ ਉਹ ਤਾਂ ਗਾਂ ਸੈਣੀ ਵਾਲੇ ਫਿਰਦਾ ਵਾ ਪੱਤਰਕਾਰ ਦੱਸੀ ਜਾਂਦੇ ਆ
This is the exact stretch where the Prime Minister's convoy was stopped. तो अब आप लोगों को पंजाब पुलिस की तरफ से कोई नोटिस या किसी इंक्वायरी या किसी के लिए बुलाया गया है, खास करके आपको, क्योंकि आप ही की एक वीडियो वायरल हो रही है जिसमें फिरोजपुर के एसएसपी आपको पहले सूचना देते हैं कि प्रधानमंत्री जाने वाले हैं, लेकिन शायद आप वो बात सच नहीं मानते हैं।
देखिए अभी तक तो कोई नोटिस नहीं आया, पर प्रशासन की तरफ से जो भी नोटिस आएगा, जो भी इंक्वायरी होगी, हम उसका सहयोग करेंगे। जो भी कुछ है ऑन रिकॉर्ड है, कोई इसमें साजिश तो है नहीं है, जो है सब कुछ सामने है। जब प्रशासन बुलाएगा तो उनकी इंक्वायरी में सहयोग करेंगे।
Meanwhile, the political slugfest continues.
ਬਾਦਲਾਂ ਨੂੰ ਵੋਟ ਪਾ ਦਿਓ, ਕੈਪਟਨ ਨੂੰ ਵੋਟ ਪਾ ਦਿਓ, ਮੋਦੀ ਨੂੰ ਵੋਟ ਪਾ ਦਿਓ, ਪਹੁੰਚਣੀ ਇੱਕੋ ਥਾਂ ਪੰਜਾਬ ਬਰਬਾਦ ਕਰਨਾ ਤੇ ਇਹਨਾਂ ਨੂੰ ਪਾ ਦਿਓ। ਉਹ ਤੇ ਕੱਲ ਪਤਾ ਲੱਗ ਹੀ ਗਿਆ ਜਦੋਂ 500 ਬੰਦਾ 70,000 ਕੁਰਸੀ ਦੇ ਅੱਗੇ ਬੈਠਾ ਸੀ ਤੇ ਅੱਜ 20,000 ਬੰਦਾ ਇੱਕ ਨਹੀਂ ਹਿੱਲਿਆ।
The Punjab government has ordered a high-level probe by a retired judge and bureaucrat which will submit a report in 3 days. The focus is now on the Supreme Court, which will hear a petition on the security breach tomorrow. With Mohammad Ghazali in Firozpur, Bureau Report, NDTV.
Well, let's move to other big headlines on the third wave. Well, the Supreme Court has said that there will be no physical hearings in the court anymore amid the third wave. The Supreme Court will hear all cases virtually from Friday, that's tomorrow, till next orders. The judges will join hearings via video conference from their homes, their residence offices, not from courtrooms, and only urgent mention matters, fresh matters, bail matters, and matters involving stays or fixed dates will be heard. No other cases will be heard at this time. Well, the Supreme Court decision came at a time, ironically, when the Delhi High Court said that the UPSC main exams will not be postponed because of despite rising COVID cases. The Delhi High Court dismissed a plea. The examinations are scheduled to start from tomorrow across the country. Lakhs of students will be giving that exam. The plea filed by 19 candidates was rejected. They had asked to postpone the mains scheduled from January the 7th to the 16th. Well, looking at our special reports on how the third wave is impacting India, well, one big difference from the second wave is that people are not wanting to get tested via the RT-PCR test. They're opting for home tests instead. A major reason for this is because Omicron variant patients were earlier meant to be hospitalized. The government has now changed that rule. So people fear that they'll be put into hospital straight away if they test positive. So rapid test kits are now flying off the shelves. We spoke to the MyLab manufacturer who makes these test kits, who said that rapid antigen tests are accurate and their results are give the right result.
If I'll know that I'm suffering from such things, I will stay home. Why would I go to metro or so, right?
At this metro station in East Delhi, where the Delhi government has set up an RT-PCR testing booth for random sampling, most people are avoiding tests in the fear that they may be mandatorily hospitalized.
अब लगभग जितने आते होते तो हम कर ही देते हैं। ये है कि हम मोबिलाइज कर सकते हैं, फोर्स नहीं कर सकते उनको। अगर हम 150 सैंपल कर रहे हैं, उसमें से अगर 20 निकल रहे हैं हमारे, कि हाँ हाल फिलहाल में अभी केसेस इंक्रीज है ही।
Until now, all known Omicron patients have been mandatorily isolated at hospitals. The fear of mandatory hospitalization had resulted in a surge in rapid antigen tests, with people preferring to buy off-the-shelf kits with their promise of anonymity. Although 7 types of rapid antigen home testing kits have been available in the Indian market for months, it wasn't until the Omicron variant hit that sales skyrocketed.
देखिए ऑल ऑफ अ सडन जो रेगुलर चीज़ें जा रही थी मास्क सैनिटाइजर उनको छोड़ के ये रैपिड एंटीजन टेस्ट किट की डिमांड ऑल ऑफ अ सडन पिछले 3-4 दिन से एक्सट्रीम हाई पे चली गई है. हम आउट ऑफ स्टॉक हो चुके हैं ऑलरेडी.
Sales of Coviself, one such kit, jumped by 200% in December. Demand for self-test kits is highest in Maharashtra, West Bengal, Rajasthan, Delhi and Andhra Pradesh. The maximum units have been sold in Mumbai, Delhi and Kolkata. In Delhi, the share of RT-PCR tests out of total tests has dropped week to week. The ICMR is also now encouraging the use of home rapid antigen tests with a connected app that will report results to the authorities. But the worry is that many people who turn out positive at home may not report themselves.
With the government clarifying that now even some Omicron patients can be isolated at home, hopefully the fear of an RT-PCR test will subside. But the government's encouragement of home self-testing and no more mandatory testing for asymptomatic cases signals a shift in India's pandemic management. Now, at this stage of the spread, contact tracing is out and the focus will be on augmenting healthcare infrastructure. With Sanjay Kaushik, Meher Pandey for NDTV.
And a question many of our viewers have been asking us is that what exactly is the difference between the second wave and the third wave in terms of symptoms of the Delta variant and the Omicron variant. So this has not clearly been outlined yet, but we spoke to top doctors from around the country and this is what they've said based on what they've seen clinically so far.
Omicron is not mild, it is a milder strain, but it does have symptoms very different from Delta. So we spoke with doctors, top doctors across the country to pick up from them some anecdotal evidence of how to actually detect Omicron early on. To start with, one of the major things is that Omicron mostly impacts your upper respiratory symptoms. And it will give you symptoms which are in the upper respiratory system. In Delta, we had seen lungs getting impacted pretty early on, and that was a danger. The other thing with Omicron is that it has a scratchy throat compared to Delta, where we had seen people develop dry cough. The next thing about Omicron is that it does give you a congested nose, something that was not seen at all in Delta. The other sort of giveaway when it comes to Omicron is that it is leading to high fever. In Delta, we had seen fever would pick up from 99 to 100 and gradually go up. In Omicron, however, it generally shoots up to a very, very high fever. Another major factor and symptom for Omicron is actually body ache, mostly seen in the lower back, sometimes leading to dizziness as well. In Delta, however, the biggest giveaway was loss of taste and smell. That's not happening with Omicron. Let's talk about symptoms next, and here Omicron a major disappointment because monoclonal antibodies seen as something which would fight Delta 100% does not work, simply does not work when it comes to Omicron, which is a major disappointment. In terms of treatment overall, well, in Omicron, if you test positive for it, your doctor is going to give you symptomatic treatment, and in case your oxygen levels drop, which it might in severe cases with older people, those with comorbidities, they will take the use of steroids as well, which is pretty much the same on how we fought Delta as well. The key here is watch out for symptoms early and stay in touch with your doctor to keep a tap on things. Sonal Mehrotra Kapoor, NDTV.
So that's not a final list, but this is what top doctors from Mumbai, Delhi, Chennai and Bengaluru have told us. We'll keep updating you with that. But meanwhile, another news, as many of 125 passengers who'd taken a non-scheduled chartered flight from Italy tested positive after landing in Amritsar this afternoon. So that's 125 out of 170 passengers, including 19 children who were on that chartered flight from Milan. So all the passengers have now been taken for institutional quarantine. But it actually is an eye-opener on how chartered flights can literally be carrying. That flight was just full of people who were COVID positive and arrived here from Italy in Amritsar. And the third wave now hitting the markets clearly. The Sensex sliding 621 points, ending at 59,602. That, of course, after a fantastic 4 days where they closed above 60,000. The Nifty falling 179 points. But global markets, however, it's not just because of Omicron, global markets declined after the US Fed said that interest rate hikes may be sooner than than expected. Remember, of course, the US is touching over 1 million cases or hovering around that number in the last few days. Well, in a major surprise, the co-founder of one of India's top private universities, the Ashoka University, has been charged with fraud by the CBI. Vineet and his brother Pranav Gupta were charged by the CBI for alleged bank fraud of 1,626 crores. The Gupta family had set up a pharmaceutical company, Parabolic Drugs, in 1996. The banks say that the Gupta brothers forged and cheated 1,600 crores. They also founded India's oldest higher education consulting firm, Jamboree Education. Vineet Gupta was the founding pro-VC of Ashoka University between 2014 to 17. They're also part of the board of trustees of Ashoka University. They were raided in multiple cities, their offices, on December the 31st. The CBI claims that incriminating documents, articles and cash are found in the raids and say that they face charges like criminal conspiracy and forgery. So far, the Gupta brothers have not responded on these charges against them. And the horrific case of the online auction of Muslim women has been solved. So the Delhi police, who swung into action after the Mumbai police arrest, and say that they've arrested the main accused, Neeraj Bishnoi. He's in his 20s, a second-year engineering student. He was arrested from Jorhat, Assam. The Delhi police say that he created the Bully Buy app on GitHub and Twitter, and that now with his case, with his arrest, the case has been solved. 3 other people have been arrested in this case, including a 21-year-old Mayank Raval, a 19-year-old woman, Shweta Singh, and another engineering student. He was studying at a Bhopal University. He's now been suspended. So really the ramifications of such horrific hate crime there. 4 young students arrested, their futures in jeopardy, at least their academic and job futures, all for this hate crime of the worst kind online. Well, in other news, India has come down heavily on China amid reports that they're constructing a bridge across the Pangong Lake in eastern Ladakh. India today said that this is being built in areas that have been under illegal occupation by China for around 60 years now, and they're monitoring the situation closely.
Regarding reports about a bridge being made by the Chinese side on Pangong Lake, a government has been monitoring this activity closely. This bridge is being constructed in areas that have been under the illegal occupation by China for around 60 years now. As you're well aware, India has never accepted such illegal occupation.